Thanks for staying with us. So it's Tuesday, so we have to have our health angle. So July is Fibroid Awareness Month. A time to shed more light on a condition that affects millions of women worldwide. Uterine fibroids are non-cancerous growths that can cause significant discomfort, pain, and complications. Raising awareness about fibroids is crucial for promoting education, early detection, and effective treatment options. Let's use this month to amplify the voices of those affected and advocate for better health care and support. By sharing stories and experiences and information, we can work together to improve women's lives who are impacted by fibroids. Fibroids awareness is not just about 1 month, it's about starting a continuous conversation on this. So with us today is a friend of the house. It's been a while we haven't seen you, an obstetrician and gynecologist, Dr. Abayomi Ajayi. Welcome back to the show. It's been a while.
Thank you. Yeah.
Good to have you.
Yeah, great to be here.
I love your jacket.
Thank you. Thank you.
So we've discussed fibroid before. Everybody knows fibroid, but there's some people that are just coming to womanhood and they're probably still just learning about what fibroid is. So let us start from the basics. What exactly is fibroid and how do we detect it?
Wonderful. In your intro, you already told us what fibroids are. They are not cancers, but they are the commonest growth in women, especially in their reproductive age. And they tend to be so common that about 70 to 80% of women will have fibroids before they are 50 years. Now, the thing is that it's not all of them that bring trouble, as it were. Some of them they're just there, and they don't need any treatment per se, and they probably might not give symptoms. But in about 25% of them, they give symptoms. And these symptoms can come from with the period. They have heavy, prolonged bleeding. They can have irregular bleeding. They can have pain. It's just, that mass or the bulk that was just below this abdomen can suddenly start giving you pain. It can be during menses, it can be completely outside menses. Then sometimes also because the uterus is near to some organs, like the bladder, the rectum, so you could start having frequent urination. So we know there is men who, when they get old, that they pee at night, but even women, when the fibroid is compressing on the bladder, you could have constipation, and sometimes you could even have infertility.
So when a young girl reaches puberty and she's predisposed to having fibroid, maybe from genetics, what would she see first that should inform her visiting a gynae? What would she see? Because most times it's when it's properly advanced that you see the person mention, I have fibroid, and I'm wondering, there are certain some signs that should present first. Most of us as women have different phases of womanhood or whatever, fertility wise, that we all experienced. I knew mine early. I just knew this thing was not normal, but I will deal with it later. So when do you say a young girl who's predisposed to fibroid, who would later have fibroid, might later have it, what would she see? What are the signs she would see first?
Well, so maybe we rephrase the question. Might not see anything. Okay, but what we're talking about probably would be early diagnosis when she has fibroids. So the commonest symptom with fibroid might just be that there is something, a lump in the lower abdomen. Okay, like we said, this might not give any symptoms initially. But the commonest thing when they have symptoms is that it's with the period. Either it's increased, the number of days increases, or it becomes irregular. So those are some of the things and that's why we're having Fibroid Awareness Month. So that women and young ladies, because what we see here now, especially in Nigeria, is late presentation. Just like you said, it now becomes so big.
And that's the one we know.
Exactly.
Every other one we say it's not.
So late presentation could be as a result of not seeing your doctors regularly, or
yes, could be, but could also be because of the option that you think is available. It's scary.
Non-medical options?
No, surgery. Because before now, when you talk about fibroids, you're only talking about surgery. And somebody says, just like what you said, you want to deal with it later. So that's one of the reasons why this awareness month is. Because one of the things that we're trying to do also is to open up the options that are available, that you don't necessarily have to have surgery. And you don't have to wait until it becomes so big that it becomes a nightmare even to the doctor that is going to do the operation, if any operation is going to be done, or any way that they want to do it.
So, mention the options, sir.
Oh, yeah.
Please.
So, yeah. So now, we in the last 4 years, we introduced a non-surgical method of treating fibroids, which we call high intensity focused ultrasound, or HIFU, just for short. And we treated over 700 women now. And so the experience is mounting. But all over the world, over 300,000 women now.
I recently talked about this particular, because I remember when you visited us last time. Yeah. I think you had just started it. And I recently talked to someone about that option as well. They found it amazing, and I give information on how they could reach you. But so my question now is, I have a child who is 11, and every time I sit down to talk about fibroids, it's the same story about when it will happen, what the options are, Like, I would rather that by the time my daughter is 21 or something, that we have new information concerning how to prevent it, how to live lifestyle, things like that, so that they're not dealing with the issues that we're dealing with today.
Exactly.
Wonderful. Yeah, but you're right. But that's one of the things that is happening now. See, despite the fact that fibroids are so common all over the world, people rarely talk about it. The funding for research is not so much. And even this month in America, they had to go to the House to go and meet with the legislators that more attention, more funding needs to be put into fibroid research. We know it's genetic. If we're able to identify the gene responsible, then we probably will be able to tackle it from the root, and prevent it being transmitted. Because now, we can do gene editing.
Yes. Yeah.
So if we are able to know what gene is affected, it's likely that we probably will bring an end to fibroids. But the money for research is just not enough for fibroids.
Okay. Yes. So do you think that increased body fat also increases the risk of fibroid? Maybe slimmer people might not run the risk, or people that have more body fat. What do you think about
Definitely, obesity is one of the risk factors. But the way to put it is this, because some slim people also have fibroids. The way to put this is that the most important factor is your gene. Now, you know that you can modify gene with behavior. Okay. For example, if you are predisposed to hypertension or diabetes, if you start preventing or avoiding the things that can trigger it on, then so the same thing with fibroids as well. So the first thing is the gene is the most important thing, but other things that can modify this. Obesity is also a risk factor for fibroids, definitely.
Let's talk about the issue of cost, because in many parts of the world, many healthcare is subsidized. People can actually lean on government to support. Is there any support for Nigerians here to treat fibroids, especially when it's at later stages?
I'm afraid maybe not, because let's look at it even holistically and say healthcare in Nigeria. Okay, not only fibroids, the insurance, health insurance in Nigeria. What percentage of Nigerians is covered? So it's just maybe about 7%, less than 10% of Nigerians are covered. So it's
is it expensive? Another question.
Well, I always answer that question by saying that it depends on who is talking. Because I see your phone, I don't think it's expensive.
Let's talk about these costs. There are costs to treating fibroids. Sometimes women now become, impossible. It becomes impossible for some women to carry their pregnancies because of their uterine wall, the fibroid costing them the uterine wall, causing the damage in it. What are the safest ways that the myomectomy will be done?
They're still talking about myomectomy.
Because, you are talking laser.
Laser.
No, I'm not talking laser, I'm talking HIFU.
HIFU. Make it again.
HIFU. High intensity focus.
Let us break that down. Help us understand how
yes, compared to myomectomy, which is safer, what are the costs, which one?
You know what you're saying? I just saw a woman yesterday who had fibroid surgery somewhere in Nigeria, and they said they removed 30-something.
Yeah.
Now this woman can't see her menses anymore. This is a 32-year-old woman who obviously wants to still conceive.
Yeah.
And that's what we're talking about now, that people should start looking not only at surgery, but other things like HIFU. It's like, seriously, and I'm saying this with all sense of responsibility. It's like you lie down on the bed on the day you are doing the surgery, you lie down on the bed, the doctor doesn't even touch you. All he focuses on, because you have done your MRI, you have done, so he has mapped all the fibroids. If you cannot treat all of them at one go, he will have told you, okay, you might need to do 2, but if you can treat all of them at one go, you lie down for 2 hours, you are even conversing with, because you are not put to sleep, you are conversing with anybody you want to converse with, and then at the end of 2 hours, maybe once in a while, because why we want you to be awake is because, you know, ultrasound is converted to heat energy and it boils the fibroids. So the water that you're lying on might become too hot for you. So you don't have burn in your abdomen. So when it becomes too hot for you, let us know. We'll stop and give it a break. Yeah. And so, and also the other thing is that because the rays might scatter to where we don't really want it to scatter to. If you start having pain in your back, let us know. We'll stop and we'll change the direction. And that's all.
So what's it called?
long-term side effects?
No sedation, no, what's it called?
We don't, you are not going to be admitted.
Surgery.
You are not admitted, you're going home that very day. You can, before you go, we've given you tea to drink. So you are going back home, you're going to start drinking and whatever. Yes, next day
so
you
can
do
eat
spaghetti.
before this procedure?
You cannot eat before,
Okay.
but you can eat after.
Right
And there are no long-term side effects for...
No.
Yeah, but
So
you know,
this-
violet rays, what's the
Ultrasound.
Ultrasound.
No, not ultrasound rays.
Oh, okay.
The ultrasound that you do normally,
Okay, the normal
now
ultrasound.
is now focused. The machine focuses it. And then is, you know, it's like this principle of when we were kids and we used to play with magnifying lenses and we'll put piece of paper down and at a particular distance it starts burning.
Yes.
That is the principle. So it converges the ultrasound rays at a particular distance, it
through
can
the
burn.
skin.
Yeah. No, you know, if you remember that thing, if you put your hand in between
Yeah,
the paper, it doesn't burn you.
But the
And
object...
that particular,
paper.
so it's so specific. And
My question now is, this machine, how many hospitals in Nigeria have it? Because do we have, is it accessible for people? Because I just are hearing you and thinking, oh my goodness, that sounds amazing. But can they access it?
Technology is expensive. Don't let us kid ourselves. And I think that's one of the banes of healthcare in Nigeria now. If we're going to do qualitative healthcare, there must be some investment. Somebody has to invest. Whether it's government, whether it's private people, there has to be some investment, some level of investment. Unfortunately now, we have 2 of these machines, one in Lagos, one in Abuja, in the whole of West Africa.
Whoa. That doesn't sound good.
That doesn't sound good.
Because I remember the lady I was talking to...
Somebody has to start. That's what we...
Okay, it takes us back to the previous procedure because obviously many Nigerians can't afford it and they can't access it. So let's go back to the previous procedure of surgery. Is it still safe as of today?
Oh, yes. You see, but let's look at it. This is the thing. There are some people who are doing surgery who are not supposed to be doing it in Nigeria. And they're cheap.
Yeah.
Okay? Or maybe they're cheaper. What I always say is that the cheapest, the most expensive does not have to be the best. But the one thing I know is that the cheapest can never be the best. Okay, so some of these guys are doing this surgery because they watch some people do it or whatever. Some of them, they call themselves qualified by experience. They are not trained. Do you understand what I mean? But they can do it. Of course, the success rate or the complications from such people is very much likely to be higher. Yeah, but there's some complications that you cannot, even if you are anybody, even if you are anything, it can happen.
Okay, so let's talk about vitamin D and the lack of it in the system, in the human body, and how it affects you, either having fibroids or increasing the risk of fibroids. Because, you know, sometimes we take certain things for granted, and we don't know maybe that at certain stage or age of puberty, you need to start taking certain vitamins to also help your body. How does vitamin D and fibroid, how do they relate?
Yeah, it's one of the things that has been linked to fibroids. But you know, what I say most of the time is that in Nigeria, okay, except for now that everybody now, you go from air-conditioned car, air-conditioned house, to air-conditioned car, to air-conditioned office. Before, vitamin D was not
A problem.
an issue with us. But now we know that it's an issue. So yes, it's one of the predisposing factors to fibroids. In fact, there is still a class act in the US that some hair relaxers could also predispose to fibroids among black people. But these are things that we were just getting to know all the risk factors.
Okay, so there's also, well, I don't even know where it came from, but we believed that the older you get, when you enter your menopause, the easier for your fibroid to die by itself. Is it true?
It's true.
Okay, so
it might not, it's not likely to grow.
Completely.
It's not likely to grow. It does not disappear.
Okay.
It's not likely to
grow. It doesn't shrink.
No estrogen.
It will shrink, but it might not disappear. Don't let me
okay.
So, because estrogen is what feeds fibroids. And when you hit menopause, your estrogen level goes down. And then, and that's one of the reasons why sometimes we say it's not every fibroid that needs to be treated. So you have to look at the person.
So there's this thing I hear from, you know, younger ladies who are dealing with fibroid now, and they say they always have the doctor say to them, go and have a baby. You know, what does that mean?
At least when they take it out.
They go and, yes, once they take it out, but please have a baby, or else the fibroid will fill up the space that a baby is supposed to be.
Yeah, well, we used to say that a lot before. Yeah, but it's true that if you know, what we said many years ago is that if uterus does not carry a baby, we carry fibroids. But that we know, because age is one of the predisposing factors to having fibroids. Now, but sometimes we know what it is now, that some women, probably they don't have a partner and they don't want to have children out of wedlock or whatever, and they have fibroids, and the fibroid wants to kill them. You have to probably have to deal with the fibroids. But now, there are also many options available. The same lady can store her eggs until she's ready. No, nothing is cheap in life.
No, it's not accessible to the average woman on the street.
I agree totally. But you see, that does not mean we should not be talking about it.
Okay.
Yeah, everybody, because I've seen so many people in life, you know, we live in communities in Nigeria, whether we like it, it's a communal life.
True.
We see somebody that you look at and say, this is a teacher. I'm not saying that teachers are not rich, cannot afford anything. But this teacher has a sister who is the CEO of somewhere. You know what I mean?
Yeah.
And so
you're thinking like an African.
Because that's how we are.
Is this that money is not our money?
No, I'm an African.
Africans will.
True and true.
So somebody is watching you right now. They have fibroid.
Yeah.
They can't afford the HIFU.
How do you know?
Yeah. I'm just telling you.
Okay.
I'm just giving you an example.
Okay.
And they've seen you on this show years back.
Yeah.
That said that, oh, okay, if you have fibroid, have a baby quickly so that it doesn't grow. Or they've been told, not by you, but by doctors, are saying that they have to remove the fibroid because it's life-threatening. Now, and they're scared. So my question to you is, the surgery today, the knowledge we have now, is it safe as for a young person, 24-year-old, 23 or 30-year-old, say, I would rather just remove the fibroid at the risk of not having a child? Or even is it safer now for her to remove the fibroid alone minus her uterus?
Let's look at it. The surgery is being the same as it was before now. But we have more trained people in Nigeria now. So what I will ask that person to do is go to a trained person, which reduces the risk of complications. But there are some complications that you cannot completely take away because you are not in control. That's why they're called complications. They're accidents sometimes. For example, anesthesia is not something that you can completely take away. Yeah, the better trained the person is, the less likely the incidence of complications. But it still happens. We say it can happen to the bishop sometimes, you know. So it still happens. Having deep vein thrombosis can happen. Do you understand? So the person who did the surgery that I'm talking about, that the patient cannot see her menses again, is a gynecologist. So it can still happen. Some complications can still happen, yes. But you reduce your risk by going to somebody who is experienced, who is qualified, okay? But you know what Nigerians do most of the time is pick up the phone. How much is mammectomy in your hospital?
Then is there a tea or a drug?
Drinking tea.
I wish we were not going to go there.
Please, we have to ask him because Nigerians are using it.
There's a tea. Somebody's head.
Let me tell you my own story. My own sister had went on this agbo when I was actually training to become a gynecologist. And finally, I was the one who removed her uterus.
Years and years.
Many years ago. So I'm sorry, my faith in that agbo.
Maybe she didn't take the right agbo because Nima has never failed.
Let me tell you something.
This agbo story that me I know.
Listen to
the person removed it. The thing came out like us or like this.
Okay, please show me the person.
Did you see it or they told you? Once they tell you,
lawyer, hearsay, lawyer. You get fashion, you get evidence, you get evidence. She take pictures, she do
Listen
video.
to some of our patients who have done this. I listen to them a lot, and the majority of them have gone through this agbo thing. One even last Sunday that we had one Facebook live came from Abuja, and she was telling me she had to got from Ghana. When the ones in Nigeria did not work, she got one from Ghana. Nah, lie. I'm sorry, but it's a good industry, but
it's a thriving industry.
Yeah, but we have natural medicine and herbs and things like that.
Maybe let me say I'm not qualified to talk about that.
Yeah, okay.
Because the King of England had cancer. And we heard that he was using herbs and alternatives. And the same,
After what?
To treat himself.
No, after what?
He didn't do chemo. He said he wasn't taking those options.
Okay.
It's in the news now.
No, I'm not saying that diet does not work for some things.
It was not diet, agbolo.
Okay, say you gave him the agbo.
She mixed it and
I sent it from backyard.
Love from Nigeria.
Those things can help you to maintain health. There's no doubt about that.
Okay.
The natural things can help us to maintain health. But for cure, well,
so it's good. I mean, we have to wrap up. It's good to know because your view has been on for 12 years.
Yeah.
And to be very unfair, after 12 years, that we're still saying the same thing about fibroids. So I'm happy that you're saying that there's new technology and there are ways of less invasive ways to treat fibroids. Fantastic news. It's not yet affordable. It's not yet accessible to everybody, but a few who can could. One here in Lagos, one in Abuja. Then you're saying that the surgery that people do is safer because we have more trained doctors who can perform the surgeries. But doesn't mean that it will still, there might not be risks.
No,
but there could be, but we're happy that the surgeries can still happen. That's the information we've gotten today.
Yes.
Thank you very much, doctor. I think on that note, we can end. Thank you, because we have our consultant, gynecologist here, obstetrician, and the gynecologist, Dr. Abayomi Ajayi. Always a pleasure having you, sir.
Same here. It's always great to be here.
A lot of people are asking for your number, so I'll send you your number today.
Okay.
That's all we can take on today's show. Hope you learned a few things as we have. Have a great day. We'll see you tomorrow. Bye for now.